Welcome to this clinical walkthrough on the Adolescent Self-Harm Assessment Case for UK MLA, brought to you by Mediate, your 24/7 practice partner. So, here's what we're going to walk through today. We'll start with the scenario and how to kick off the conversation. Then, we'll dive deep into assessing the self-harm itself, explore the bigger picture, figure out how to pull it all together in a summary, and wrap up with a solid management and safety plan. Okay, let's get right into it. Those first few minutes with your patient are everything. You have to create a space that feels empathetic and completely non-judgmental. That's how you'll build the trust you need to get an honest history.
Right, picture this. You're the psychiatry doctor. A 16-year-old girl has come in after taking an overdose of oral contraceptive pills and also cutting her wrist. A&E has already confirmed she's medically stable. So now it's over to you to do this psychiatric assessment. This is how you should start, word for word. Why does this work? Because you're immediately showing you understand she's in distress. You're not accusing, you're empathizing. And that simple validation opens the door for a real conversation.
Now for the assessment itself, and this is absolutely crucial. You have to treat the pill overdose and the wrist cutting as two completely separate things. They might have happened around the same time, but their motivations and the risk they carry could be totally different. First, let's tackle the tablet ingestion. We need to ask some really specific questions to figure out the context and, importantly, the intent behind it. You need to run through these questions. What kind of tablets? How many? When? But look, the most important one here is what made you decide to take them? This is where you'll likely uncover the trigger, that fear of pregnancy. That's a massive piece of the puzzle. And of course, always ask about alcohol or other drugs. Okay, moving on to the second act. The best way to assess the wrist cutting is to break it down. Think of it in 3 simple phases: what happened before, during, and after. This framework will give you a complete picture of the risk. So for the before phase, use language exactly like this. Asking about planning is key. Did she write a note? Give things away? Actions like that are huge red flags for suicidal intent. If she didn't, it points more towards an impulsive act. Now for the during and post phases. Here, you're trying to get a feel for the circumstances and her mindset. Were you alone? What were you thinking in that moment? And this is big. How did you get help? The answers tell you so much about her intent and whether she has some will to live and accept help. All right, we've got the specifics of what happened. Now we need to zoom out. A proper risk assessment isn't just about last night. You need to understand her world, how she's feeling right now, her general mental state, and what her support system looks like. These questions are your window into future risk. Ask her how she feels now. Does she regret it? And here's the clincher. If things got this tough again, what do you think you'd do? Her answer to that is one of the strongest predictors you have. You also need to take a quick, structured history. Think of it in 3 parts. First, mental health. Any past episodes like this? Any diagnoses? Second, social history. What's going on with her partner, family, school? This tells you about stressors and support. And finally, family history. All of this together helps you build a full 3-dimensional picture of your patient. Remember, you can practice this exact case right now and get objective feedback on mymediate.com. Because the fear of pregnancy seems to be the trigger for the overdose, you have to assess this risk directly and clearly. Don't beat around the bush. Ask these questions. It's a fundamental part of your assessment and your management plan.
So you've gathered all this information. What's next? You summarize it back to her. And this isn't just a simple repeat of the facts. This is your chance to show her you've truly heard her and understood her experience. It's an incredibly powerful tool.
Use phrasing just like this. See how it separates the 2 acts? It frames taking the pills as an act of fear and the cutting as a way of dealing with overwhelming distress. This demonstrates a deep level of understanding and validates her emotional state.
And this is what it all boils down to. Clinically speaking, we see the pill ingestion as an impulsive act driven by a specific fear, not a suicide attempt. The wrist cutting, on the other hand, is an act of self-harm, a way to express emotion. Making this distinction is the core of a good assessment.
All right, we're on the home stretch. The final part of your consultation is creating a management plan. It has to be clear, safe, and supportive. It's all about education, classifying risk, and making sure she has a safety net.
Your plan needs these 3 pillars. Number 1, medical clarification. Number 2, risk classification. And number 3, a solid follow-up and safety netting plan so she's supported when she leaves.
This is a non-negotiable. You have to correct her misunderstanding. You need to clearly explain that contraceptive pills don't end a pregnancy. Then you follow through by arranging a pregnancy test and recommending she see her GP about contraception. So why do we classify this as low risk? Because here's the evidence. It was impulsive, no planning, the method wasn't highly lethal, she accepted help, she regrets it, and she says she wouldn't do it again. These are the facts that support your conclusion.
And this is how you communicate the plan. Listen to the wording carefully. You don't say, you are low risk. You say, it seems unlikely. It's safer. You also show you're part of a team by saying you'll discuss it with a senior. Then you clearly lay out the next steps: discharge, a referral, and a crisis card for immediate support.
Nailing this approach will give you the confidence to handle these tough consultations safely and effectively. You can practice this exact case now on mymediate.com.